on substance use disorder among nurse use disorder, the Florida Department of Welcome to Recognizing Impairment in the Workplace course. This course will highlight on substance use disorder among nurses, including rates, risk factors, signs and symptoms of impairment, the Florida Nurse Practice Act in regards to substance use disorder, the Florida Department of Health enforcement process, the Intervention Project for Nurses, or IPN, and the promotion of a transparent and non-judgmental workplace. After each module, a case study will be presented following a nurse's story on substance use disorder. The profession of nursing is one that has much integrity and a lot of trust from the general public. Substance use disorder is not generally accepted in society, and when it comes to nurses having substance use disorders, this holds much stigma, myths, misconceptions, and negative prejudices. This course will assist to eradicate some of those myths and misconceptions and encourage open discussion on substance use disorders among nurses.
Upon completion of this course, the participant will be able to define the terms abuse, dependence, impairment, substance use disorder, and addiction. Identify the prevalence of substance use disorder among nurses. Distinguish the risk factors, signs, and symptoms of impairment. Discuss the legal obligation to report on impairment and analyze the necessary steps to complete a report. Evaluate the available treatment programs for nurses. Describe a safe, transparent, and non-judgmental workplace.
We've all heard and used the terms abuse, dependence, impairment, substance use disorder, and addiction, and probably interchangeably. Usually we associate these terms with patient intake and care, but for this course it is important to understand how each of these terms relate directly to us, professional nurses, and the topic of recognizing, treating, and recovery from workplace impairment. As this course unfolds, it will be essential to understand each term's individual meaning. So before we begin, let's review a few terms associated with workplace impairment. The National Council of State Boards of Nursing Substance Abuse Disorder in Nursing Resource Manual discusses the term abuse in regards to prescription drugs. Abuse refers to using prescription drugs without a designated script, using a prescribed dosage in excess, or using a prescribed drug for reasons other than what it was intended for. Dependence. According to the National Institute on Drug Abuse, dependence is a state in which the body functions normally only in the presence of a drug. This can be shown by a physical disturbance, termed as withdrawal, when the drug is removed from the body. Impairment. According to the National Council of State Boards of Nursing Substance Use Disorder and Nursing Resource Manual, impair means to function poorly or incompetently. Impairment can affect alertness, memory, concentration, attention, reaction time, coordination, multitasking, perception, and thought processing. Even though a nurse may have a substance use disorder, they may not necessarily always be impaired. A nurse with a substance use disorder may, in fact, function highly and appropriately. The term impaired may not always be accurate because a person with a substance use disorder may not necessarily be impaired to the point where they cannot function properly. Substance use disorder. According to the National Institute on Drug Abuse, in 2013, The American Psychiatric Association updated the Diagnostic and Statistical Manual of Mental Disorders to its 5th edition. This is the diagnostic manual of all known mental disorders. The categories of substance abuse and substance dependence were merged into a single category named substance use disorder. This disorder has symptoms divided into 4 groups: impaired control, social impairment, risky use, and pharmacological criteria such as tolerance and withdrawal. Addiction. According to the National Institute on Drug Abuse, addiction is a chronic and relapsing brain disease that presents with compulsive drug seeking and use, regardless of probable negative consequences. The American Psychiatric Association does not use this term as a diagnosis, but the National Institute on Drug Abuse currently uses this term. Addiction is an umbrella term that includes alcoholism, drug addiction, chemical dependence, and substance use disorder. Substance use disorder, SUD, among nurses has long been a sensitive and under-discussed issue, despite being historically recognized within healthcare circles. As early as 1907, Annie Hobbs, writing in the Nursing Times, highlighted the struggles faced by nurses, noting the case of 6 nurses dismissed from their roles for alcohol use. The nurses reportedly used alcohol to cope with the physical and emotional exhaustion that came with the demands of their profession. The use of alcohol, in their case, was seen as a way to help them sleep after long, taxing shifts. However, these nurses were described as having a slur on her character, reflecting the stigma and shame associated with substance use during that period. Further support for the idea that nurses may be vulnerable to substance misuse due to their stressful work environment was provided in 1915 by Dr. C.V. Pearson. He noted that the pressures of nursing, combined with the easy access to potent substances such as morphine and opium, created an environment in which nurses might be more prone to misuse drugs. Pearson's observations suggest that the combination of long hours, physical strain, and emotional stress made nurses susceptible to turning to substances as a form of self-medication. These early writings are a reminder that the issue of substance use disorder in the nursing profession has deep historical roots, and the stigma around it has been long-standing. Despite ongoing challenges, these early discussions also show that the recognition of the issue is not new, although it remains a taboo subject that is often not fully addressed in modern healthcare environments. A 1998 study conducted by Trinkoff and Storr found that overall, nurses had lower rates of smoking nicotine, marijuana, and cocaine use compared to the general population. However, the misuse of prescription drugs among nurses was notably higher, more than double the rates found in the general population. This study highlighted several factors influencing substance use among nurses. Greater job demands. Nurses often face high stress due to the demanding nature of their jobs, which can contribute to higher rates of substance misuse. Adverse work schedules, irregular hours, long shifts, and night shifts can disrupt a nurse's work-life balance and contribute to fatigue, stress, and potentially substance use as a coping mechanism. Access to controlled substances. Nurses have relatively easy access to prescription drugs due to their roles in administering medications. This access, combined with frequent administration and more lenient wastage policies, can increase the risk of misuse. The Nurse Work-Life and Wellness Study, 2020 to 2021, again conducted by Trinkoff and Storr, aimed to assess how, or if, the prevalence of substance use among U.S. nurses had changed since their previous study over 25 years ago. The following is a summary of the findings. Study overview. Participants, 1,170 randomly selected licensed nurses across 9 states, participated in the survey, which was administered either online or through paper questionnaires. Substance use. Of the respondents, 442 nurses, 37.8%, reported substance use in the year prior to the survey. Substance use prevalence among nurses. Illicit drug use. 5.7% of nurses reported using illicit drugs such as marijuana, cocaine, methamphetamine, hallucinogens, or heroin in the past year. Prescription drug misuse. 9.9% of nurses reported misusing prescription drugs, including benzodiazepines, opiates, non-narcotic pain relievers, and stimulants. Alcohol. 30.9% of nurses reported consuming alcohol with 3 or more drinks per occasion at least once in the past year. Nicotine. 8.8% of nurses reported using nicotine products, including tobacco, e-cigarettes, and nicotine patches. Energy drinks. 12.1% of nurses reported using energy drinks or over-the-counter stimulants. Caffeinated beverages. 21.7% of nurses reported drinking more than 4 cups per day of caffeinated beverages like coffee or tea. CBD. 11.1% of nurses reported using CBD, cannabidiol products, which are often used for relaxation or stress relief. Key observations. Prescription drug misuse continues to be a notable concern, reflecting the ongoing issue of substance use in the healthcare setting, especially regarding medications with high potential for abuse, like opiates and benzodiazepines. Alcohol use is also significant, though it is important to note that this figure doesn't specify if it is associated with problematic drinking, for example, binge drinking, or alcohol use disorder. The data on nicotine use suggests that while it remains a concern, it is somewhat lower compared to the general population, possibly reflecting the healthcare profession's increased awareness of smoking risks. Energy drinks and caffeinated beverages are notable as they could be related to the high stress and fatigue nurses often experience in their demanding roles. The use of CBD is more recent, but increasingly recognized as a substance used for its calming effects, which may also be linked to managing stress and anxiety in the nursing profession. Other key points. Nurse prescription misuse. Misuse of prescription drugs by nurses continues to be higher than in the general U.S. population. Substance use disorder, SUD, rates. The rate of substance use disorder, SUD, among nurses, 6.6%, is similar to the overall population, U.S. rate, 7.4%, based on data from SAM HSA 2020. Workplace exposure factors. Factors in the workplace, such as the availability of prescription drugs, frequent administration of medications, nurses' knowledge about drugs, and workplace controls, were found to be associated with higher rates of prescription drug misuse among nurses. According to the National Council of State Boards of Nursing Substance Use Disorder and Nursing Resource Manual, risk factors for substance use disorders can be classified as psychological, behavioral, social, demographic, familial, and genetic. As we go through each of these classifications, we will list the various factors associated with the classification. Psychological factors include the following: depression, anxiety, low self-esteem, low self-tolerance, desperation, loss of control over life circumstances, resentment, and other mental health disorders. Behavioral factors include use of substances, aggressive behavior during childhood, conduct disorder, impulsivity and risk-taking tendencies, alienation and rebelliousness, school-based academic or behavioral issues such as dropping out of school, being involved with the criminal justice system, or the person's first illegal use having occurred at an early age, peers using alcohol and drugs, social or cultural norms, acceptance of alcohol and drug use, and poor interpersonal relationships. Social factors include condoning the use of alcohol and drugs, expectations of the positive effects of alcohol and drugs, access to or an availability of alcohol and drugs. Demographic factors such as the male gender, low socioeconomic status combined with residence in an inner city or rural setting, and lack of employment opportunities. Familial factors include the following: parents, siblings, or spouse using alcohol and drugs, family dysfunction, lack of positive family rituals and routings, poor parenting skills, and family trauma. Genetic factors account for 40 to 60% of risk and include the following: inherited genetic predisposition, deficits in natural neurotransmitters, absence of aversive reactions such as flushing or palpitations. Now that we've covered the 6 classifications of risk factors: psychological, behavioral, social, demographic, familial, and genetic, let's move on to the possible signs and symptoms of substance use disorders. The signs and symptoms can be divided into 3 categories: job performance, personality and mental status, and diversion. The signs and symptoms of job performance are excessive use of sick time, absence without notice or last-minute requests for time off, coming to work on days off or while on vacation, and volunteering for overtime, long or frequent breaks, frequent and/or unexplained disappearances, waiting to be alone to access narcotics, or lack of witnesses to verify wasting of unused medications, performing the minimum amount of work necessary, increasing difficulty meeting appointments or deadlines on time or failing to meet them at all, excessive number of mistakes such as incorrect narcotic counts, excessive use of perfume, breath mints, chewing gum, or mouthwash, wearing long-sleeve shirts or arm sleeves, extravagant excuses for behavior, and denial of an existing problem. Personality and mental status signs and symptoms include inappropriate verbal and/or emotional responses, such as unpredictability, defensiveness, and irritability, diminished alertness, forgetfulness and confusion, isolation, and withdrawal. Diversion signs and symptoms include consistently volunteering to administer medications for others, signing out controlled drugs more than the other coworkers, having a greater number of pills or more frequent administration of medications, frequently reporting medication spills, not having administered medications that should have been given to the patient, or administering the partial dose of a medication, failing to obtain co-signatures when necessary, reporting excessive uses of as-needed medications, discrepancies with end-of-shift medication counts, and evidence of tampered drug containers. Not everyone will present with signs and symptoms of substance use disorder the same way. Some people may be extremely obvious, while others may have very subtle signs and symptoms that can easily be overlooked or misinterpreted. One person's substance use disorder may be recognized with one very noticeable or major incident, while another person may be recognized after an extended period of time when a pattern is formed or until an obvious incident finally occurs. One person may be clearly impaired with poor functioning, while another person can be functioning competently. It is important to be aware of the general signs and symptoms, but in addition to this, it is also imperative to have good judgment and critical thinking and trust your instincts. Let's walk through Jasmine's story. Jasmine is a 32-year-old nurse in a cardiac progressive care unit with 10 years of clinical experience. She is in her second to last semester in a master's program to become a nurse practitioner. She is married with a 6-year-old son. She has been regarded as a reliable and diligent worker by her nurse manager and colleagues. She acts as the relief charge nurse when needed and frequently precepts graduate nurses. Many of the nurses on the unit look up to her and rely on her for support and assistance. Within the past couple of months, Jasmine has been experiencing marital issues that have not improved, but have only been worsening. Jasmine and her husband have attempted seeking professional counseling, but it has not helped at this point. She has not told anyone at work of her marital issues. In the past few weeks, she has taken to drinking 4 to 5 glasses of wine on a nightly basis to drown out her sorrows. She has convinced herself that her drinking is temporary and can be stopped whenever she so desires. She continues to function competently at work with a high performance. 2 months later, her marital issues continue to worsen, and she continues to drink on a nightly basis, but is now up to drinking 1 bottle of wine 3 to 4 times per week. She has thought of cutting down on her drinking, but disregards the idea and convinces herself that she could stop at any time. Her graduate studies have been affected. She is forgetting to submit assignments on a more frequent basis. She does not study enough for her quizzes and exams. Her attendance to classes is at an all-time low. Without a doubt, she is failing her courses. One day, during her shift, she injures her back severely when she breaks the fall of a patient. She seeks medical attention and is not allowed to go back to work until she is reevaluated in 3 weeks. She is ordered physical therapy and prescribed narcotics and muscle relaxants. Without being able to work, she has more time to dwell on her current issues. Thus, she falls further into depression, and her nightly glasses of wine are now paired with prescribed narcotics. After 3 weeks, she has been cleared to return to work, but her function at work has become incompetent. She is occasionally forgetful, inattentive, and easily confused. She has had a couple of inappropriate outbursts towards her coworkers. However, her coworkers just misinterpret these signs as a bad day that she is experiencing. She has been taking her narcotic medications in excess from what has been prescribed. She asks her friend, who is a physician, for a script, using the excuse that the pain is too much and the current script was just not enough. She knows she cannot keep asking her friend for scripts, so she begins taking medications from the unit's medication dispenser when no one is around. She waits until everyone leaves the medication room, does not weigh narcotic medications as she should, withdraws medications from the medication dispenser as if she were going to give them to a patient, and charts the medications as if she gave them, but keeps the medications, and she fakes dropping medications by accident. It's now been 6 months, and she and her husband are discussing divorce. Her son has been having issues at school with fights, and his academic performance is suffering. She has failed her graduate courses and has not registered to retake them. One day, during her shift, Jasmine and one of the graduate nurses, named Dina, are in the medication room. Jasmine pretends to drop a pill that is a narcotic and acts as if she is going to throw it away. Dina leaves, but then realizes she forgot a syringe and rushes back into the medication room, only to find Jasmine putting the pill in her pocket instead of discarding it. Dina disregards what she saw because it was too bizarre to be real, but as the day goes by, she becomes suspicious of Jasmine.
Per the Florida statutes or written laws, a nurse can experience unfavorable outcomes due to substance use disorder and the non-reporting of someone in violation. In this section, we will be covering the statutes in the state of Florida. As we go through each statute, you will notice the chapter and section will be listed in the top right corner of the window. This will provide you with the exact reference in case you would like to read more. Unfavorable outcomes due to substance use disorder. In accordance with the Florida Department of Health, Florida Board of Nursing, Nurse Practice Act, Chapter 464 Florida Statutes, further discusses this in Section 018(1)J. 1. The following acts constitute grounds for denial of a license or disciplinary action, as specified in Statute 456.072, 2. J. Being unable to practice nursing with reasonable skill and safety to patients by reason of illness or use of alcohol, drugs, narcotics, or chemicals, or any other type of material, or as a result of any mental or physical condition. In enforcing this paragraph, the Department shall have, upon a finding of the one State Surgeon General or the one State Surgeon General's designee, that probable cause exists to believe that the licensee is unable to practice nursing because of the reasons stated in this paragraph, the authority to issue an order to compel a licensee to submit to a mental or physical examination by physicians designated by the Department. If the licensee refuses to comply with such order, the Department's order directing such examination may be enforced by filing a petition for enforcement in the Circuit Court, where the licensee resides or does business. The licensee against whom the petition is filed shall not be named or identified by initials in any public court records or documents, and the proceedings shall be closed to the public. The Department shall be entitled to the summary procedure provided in S. 51.011. A nurse affected by the provisions of this paragraph shall at reasonable intervals be afforded an opportunity to demonstrate that she or he can resume the competent practice of nursing with reasonable skill and safety to patients. What about the nurse who is mandated to report a person who they know is in violation of the law? Chapter 464, Section 018(1)K states the following. 1. The following acts constitute grounds for denial of a license or disciplinary action, as specified in Statute 456.072, 2. K. Failing to report to the Department any person who the licensee knows is in violation of this part or of the rules of the Department or the Board. However, if the licensee verifies that such person is actively participating in a board-approved program for the treatment of a physical or mental condition, the licensee is required to report such person only to an impaired professionals consultant. The current rules of the Florida Board of Nursing Administrative Code, Chapter 64B9, Section 8.006, Disciplinary Guidelines, Range of Penalties, Aggravating and Mitigating Circumstances, states the following. 3. The following disciplinary guidelines shall be followed by the Board in imposing disciplinary penalties upon licensees for violation of the noted statutes and rules. G. Engaging or attempting to engage in the possession, sale, or distribution of controlled substances, as set forth in Chapter 893, Fs. For illegitimate purposes. Being unable to practice nursing with reasonable skill and safety to patients by reason of illness or use of alcohol, drugs, narcotics, or chemicals, or any other type of material, or as a result of any mental or physical condition, testing positive for any drug, as defined in Section 112.0455 FS, on any confirmed pre-employment or employer-ordered drug screening, when the practitioner does not have a lawful prescription and legitimate medical reason for using such drug, or being terminated from a treatment program for impaired practitioners for failure to comply without good cause with the terms of the monitoring or treatment contract, or not successfully completing a drug or alcohol treatment program, Section 456.072(1) ZEA, or HH, or 464.018(1) or JEFS. The first offense includes a minimum of a $250 fine, suspension, and an evaluation by the Intervention Project for Nurses and Probation, and the maximum includes a $500 fine and suspension. The second offense includes a minimum of a $500 fine, suspension, and an evaluation by the intervention project for nurses, and the maximum is revocation. Failing to report to the department any person who the licensee knows is in violation of this part, or of the rules of the department or the board. However, if the licensee verifies that such person is actively participating in a board-approved program for the treatment of a physical or mental condition, the licensee is required to report such person only to an impaired professionals consultant. The first offense includes a minimum of a $100 fine and continuing education, and a maximum of a $250 fine and probation. The second offense includes a minimum of a $250 fine and probation, and a maximum of a $500 fine, continuing education, and suspension.
Now you are in a position in which you have to report a colleague who is in violation. In this section, we will be covering the complaint process, investigative services, and prosecution. We'll define how to file a complaint, elements that are required for an investigation, the governing bodies that impact the investigation process, and reiterate the prosecution event line and what to expect. Impairment of a nurse's ability to provide safe nursing care may report this nurse to the Florida Department of Health and/or Intervention Project for Nurses. Under Florida's mandatory reporting law, all licensed nurses must report any suspected impairment in practice to the Department of Health and/or three options to choose from: business, person, or both. If you choose person, you will then have two options to choose from: licensed health care professional or practicing health care without a license. If you click on the former, you have a list of options to choose from and will choose the last option, all other issues. The website will then take you to a link to access the PDF document, Healthcare Provider Complaint Form. It is important to be factual and detailed when submitting a formal complaint to the Florida Department of Health. Details including who, what, when, and where are the basics. In addition to these basics, you will need to include how the situation was discovered, if any witnesses were present, and supporting documentation such as medical records, medication counts, and timestamps, and email correspondence. In regards to controlled substance diversions, more details will be needed, such as the actual drugs, if the nurse diverted for self-use, any unsafe behavior, falsification in patient records, if the nurse has a history of being arrested for obtaining controlled substances by fraud, deceit, or possession, if the nurse has undergone drug testing and what those results were, if the drug testing was random or part of an investigation, and any other relevant supporting documentation. This is an example of the Healthcare Provider Complaint Form. We have included the PDF of this form, as well as instructions for completing and processing in the More Information tab within this course. Once you have completed this form in its entirety, the form is to be mailed to the following address: Consumer Services Unit, 4052 Bald Cypress Way, Bin C 75, Tallahassee, Florida 32399-3275, or it can be emailed to mqa.consumerservices@flhealth.gov, or it may be faxed to 850-488-0796. The Florida Department of Health assigns all complaints with a computer-generated complaint number in order to efficiently track each complaint. An acknowledgement of receipt will be sent to the complainant. This is the person who submitted the complaint, with a complaint identification number. The Consumer Services Unit, or CSU, is the central unit that receives all of the complaints and has staff review each complaint for possible violations of regulations and laws. If a complaint is legally sufficient with further investigation needed, the CSU will refer the complaint to the Investigative Services Unit, or ISU. The ISU investigates complaints against healthcare practitioners who are regulated by the Florida Department of Health, which includes nurses. Complaints that can immediately put public safety at risk take priority for the ISU. When an investigator is assigned a complaint, they will contact the complainant and give the complainant an opportunity to provide more information. In general, the steps for investigation include the following: obtaining and reviewing medical records, documentation, and evidence, locating and interviewing relevant parties, such as the complainant, the patient, the subject, and any witnesses, drafting and serving subpoenas. These are written orders to the relevant parties to attend court in order to provide necessary information. Once the information has been collected, the investigator will write a report, and this report will then be forwarded to the department's attorneys for legal review. The investigative report is then handled by the Prosecution Services Unit, or PSU. The PSU provides legal services of all healthcare boards and councils. After reviewing the investigative report, the attorneys will recommend a course of action, such as an emergency order. This has two categories: restriction and suspension, utilized by the Florida Department of Health Secretary against licensees who are an immediate threat to public health and safety. The subject is permitted a hearing before final legal action is taken by the Florida Board of Nursing or Department of Health. An expert review. This is when healthcare professionals who are experts are appointed to review completed investigations and provide opinions as deemed appropriate. If the findings present a probable cause for evidence that supports the allegations, then a case disposition is dealt by the Probable Cause Panel, or PCP. This panel includes 2 or 3 board members. 1 or 2 of them is usually a healthcare professional and 1 is a consumer member. The PCP decides whether to dismiss a case or file an administrative complaint for further legal action to take place. A closing order. This is recommended by the PCP when the investigation and/or expert opinion do not support the allegation, which is a claim that someone has done something that is illegal. Both the complainant and subject are notified of the results. Since the case is essentially closed with a closing order, this is considered confidential and is not a public record. An administrative complaint. This is recommended by the PCP when the investigation and/or expert opinion do in fact support the allegation. After an administrative complaint is filed with the Florida Department of Health's agency clerk, the subject is then required to fill out an election of rights form where they choose one of the following legal actions. Hearings involving disputed issues of material fact. This occurs when the subject disputes the facts within the administrative complaint and chooses to have a hearing before the Division of Administrative Hearings. If this is the outcome, then all of the relevant parties may be asked to testify. Consent and/or stipulation agreement. This occurs when the subject agrees to be presented before the board or department. The terms of this agreement may include penalties which are negotiated between the subject or subject's attorney and the prosecution's attorney. Hearings not involving disputed issues of material facts. This occurs when the subject does not dispute the facts within the administrative complaint. The subject chooses to be heard before the board or department. At the time of the hearing, the subject will be allowed to give oral and/or written evidence in order to lessen or oppose the agency action. Voluntary relinquishment of license. This occurs when the subject chooses to surrender their license and terminate their practice. The final outcomes will be a final board action and disposition that will lead to final order imposing discipline that is filed by the Florida Department of Health. the subject may be permitted to appeal the final order. If the subject chooses to appeal the final order, then the PSU attorney will defend the final order before the appellate court, which is the court that oversees applications for decisions to be reversed. An appeal can be a time-consuming process with more monetary fees. You can go into a more in-depth review of the Florida Department of Health's Division of Medical Quality Insurance Enforcement Process map in the More Information tab. On the other hand, the Intervention Project for Nurses website directs you to call the following telephone number, 1-800-840-2720, in order to make a referral and/or confidential consultation. Be prepared to answer specific questions such as who, what, where, and when. You can contact the Intervention Project for Nurses without having to go through the Florida Department of Health. Dina continues to be suspicious of Jasmine and watches her closely whenever they work together. On one particular day, Jasmine decides to drink a few glasses of wine before heading to work to steady her nerves. On that day, Dina is also working and happens to smell a hint of wine from Jasmine's breath. She also notices that Jasmine's reaction is abnormally slow when in conversation, with occasional slurred words. And throughout the day, Jasmine has excessive bouts of confusion. Dina is convinced that Jasmine drank wine prior to coming to work. She is unsure of what to do next, but then decides to notify the nurse manager since patient safety is at risk. Jasmine denies those observations, but the nurse manager is not convinced and sends Jasmine home. Dina also reported to the nurse manager of the incident she witnessed in the medication room where Jasmine kept the narcotic medication she dropped. The nurse manager audits Jasmine's previous documentation and notices discrepancies in her charting with the narcotic medications. The nurse manager also audits the medication dispenser and notes discrepancies on narcotic counts. The nurse manager calls Jasmine into her office to question her in regards to Dina's observations. Jasmine is contacted by the nurse manager and informed that she will be reported to the Florida Department of Health and is not to come to work until further notice from the Department of Health. The nurse manager reports Jasmine to Human Resources as well. Both Dina and the nurse manager report Jasmine to the Florida Department of Health. Since this is Dina's first time ever reporting someone, the nurse manager mentored her through the process. Dina goes to the Florida Board of Nursing website and finds the File Complaint link that directs her to the Florida Department of Health's website. She then accesses the healthcare provider complaint form and fills it out and submits it. A few days later, she is contacted by the ISU for further information. The nurse manager is contacted by the ISU for further information as well. Needless to say, an emergency suspension order has been issued and Jasmine's nursing license has been immediately suspended by the Department of Health until further evaluation can be made. A nursing license provides the nurse with an ability to earn a living, and because of this, a nursing license is a form of property that cannot be taken away without giving the nurse due process of the law. The nurse must be provided a notice of charges and an opportunity to be heard by an impartial tribunal. The degree of due process involves the balance of property interest, risk of error in depriving someone of that interest, and the government's interest in proficient administration. If a nurse is found with a substance use disorder, a nursing license provides the nurse with an ability to earn a living, and because of this, a nursing license is a form of property that cannot be taken away without giving the nurse due process of the law. The nurse must be provided a notice of charges and an opportunity to be heard by an impartial tribunal. The degree of due process involves the balance of property interest, risk of error in depriving someone of that interest, and the government's interest in proficient administration. If a nurse is found with a substance use disorder, a final order of discipline will be issued. The final order of discipline can include more monetary fees, fines, permanent revocation or suspension of licensure, practice restrictions, corrective action, remedial education, reprimand issuance, mandating the nurse to enroll in a monitoring program with the IPN, Intervention Protection for Nurses, and whatever else the Board of Nursing sees fit. Disciplinary action is also considered public record and must be reported to both national and federal databanks, such as the NurseA's Databank of the National Council of State Boards of Nursing and the National Practitioners Databank. The traditional disciplinary approach is time-consuming, costly, stringent, inflexible, and very stressful.
The Florida Statute 456.076, Treatment Programs for Impaired Practitioners, states the following. 1. For professions that do not have impaired practitioner programs provided for in their practice acts, the department shall, by rule, designate approved impaired practitioner programs under this section. The department may adopt rules setting forth appropriate criteria for approval of treatment providers. The rules may specify the manner in which the consultant, retained is set forth in subsection 2. Works with the department in intervention. Requirements for evaluating and treating a professional. Requirements for continued care of impaired professionals by approved treatment providers. Continued monitoring by the consultant of the care provided by approved treatment providers regarding the professionals under their care, and requirements related to the consultant's expulsion of professionals from the program. The non-disciplinary approach has existed since the 1970s and is more appealing than the traditional disciplinary approach. According to the rules of the Florida Board of Nursing Administrative Code, Chapter 64B9, Section 8.006, Disciplinary Guidelines, Range of Penalties, Aggravating and Mitigating Circumstances. 1. The legislature created the board to assure protection of the public from nurses who do not meet minimum requirements for safe practice or who pose a danger to the public. The suspensions, restrictions of practice, and conditions of probation used by the board in discharging its duties under Sections 464.018 and 456.072 FS shall include, but are not limited to, the following. A. Suspension until an appearance before the board or for a definite time period and demonstration of ability to practice safely. B. Suspension until an appearance before the board or for a definite time period and submission of mental or physical examinations from professionals specializing in the diagnosis or treatment of the suspected condition, completion of counseling, completion of continuing education, and ability to practice safely. C. Suspension until fees and fines are paid or until proof of continuing education completion is submitted. D. Suspension until evaluation by and treatment in the intervention project for nurses. E. Suspension stayed, as long as the licensee complies with probationary conditions. F. Probation with the minimum conditions of not violating laws, rules, or orders related to the ability to practice nursing safely, keeping the board advised of the nurse's address and employment, and supplying both timely and satisfactory probation and employer/supervisor reports, or the requirement that work must be under direct supervision on a regularly assigned basis. G. Probation with specified continuing education courses, in addition to the minimum conditions. In those cases involving unprofessional conduct or substandard practice, including record-keeping, the board finds continuing education directed to the practice deficiency to be the preferred punishment. H. Personal appearances before the board to monitor compliance with the board's order. I. Administrative fine and payment of costs associated with probation or professional treatment. In regards to subsection D, the nurse's license is first suspended, with the nurse not being allowed to practice until the Intervention Project for Nurses, or IPN, initially evaluates the nurse and recommends a treatment plan. The nurse must then comply with the treatment plan, as they are being closely monitored. The IPN then decides if the nurse is considered safe to return to work. If the Board of Nursing ordered for the IPN's involvement and the IPN considers the nurse safe to return to work, the IPN will then notify the Board of Nursing of the nurse's active status within the IPN. As long as the nurse is compliant with all of the terms and conditions required by the IPN, the nurse is allowed to work under strict conditions. This method allows for the compliant nurse who has been approved by the IPN to return to practice nursing and continue earning a living. If the nurse fails to comply with the requirements by the IPN will terminate the nurse, and the IPN will report it to the Florida Department of Health/Florida Board of Nursing. In case you were wondering, the IPN does readmit nurses and has a readmission policy. We will further discuss the IPN and its role in the following section. Another benefit to the non-disciplinary approach is if the nurse is initially referred to the IPN instead of first being reported to the Florida Department of Health, it will not be made a public record. Again, it is important to remember that if the nurse fails to comply with the requirements made by the IPN will terminate the nurse, report it to the Florida Department of Health, and a disciplinary outcome may occur and become a public record. On October 1, 1983, a legislation sponsored by the Florida Nurses Association was passed for the Intervention Project for Nurses, or IPN, a monitoring program for practitioners to act as a liaison between the Florida Board of Nursing, the Florida Department of Health, treatment providers, and the nurse. Nurses may be referred to the IPN if their violation is due to impairment from drugs, alcohol, psychiatric, or physical problems. Most of the nurses who participate in the IPN have volunteered, instead of being reported to the Florida Department of Health and/or Florida Board of Nursing. The IPN has the following 5 objectives. 1. To protect health, safety, and welfare of the public, as risks to patients increase when a nurse providing care has an active impairing condition. 2. To offer consultation and educational programs, to encourage earlier identification and action when fitness to practice concerns are present. 3. To provide support and monitoring to nurses appropriate for IPN while assisting each to maintain professional licensure. 4. To supply a cost-effective avenue to help nurses as an alternative to the traditional disciplinary process. 5. To retain nurses in the nursing profession. The IPN's ongoing monitoring includes, but is not limited to, the following: inpatient treatment programs, Weekly mutual support group attendance. Weekly nurse support group attendance. Meeting attendance logs. Random alcohol and other drug testing. Employer reports. Facilitated support group reports. Quarterly evaluations. And a quarterly self-report. The IPN has a return to work criteria that includes assessing the following: stability in recovery, support systems, problem-solving ability, cognitive functioning, judgment, ability to psychologically cope with stressful situations, decision-making ability in a crisis. If the nurse is allowed to return to work, the IPN has a comprehensive list of requirements that the nurse must abide by, including direct supervision,